So just by a show of hands, how many people have acid reflux, GERD, heartburn, gastritis, peptic ulcer? Yeah, it's there. Okay, pretty much everyone. And the numbers that we're going to go through, we're going to see that the billions of dollars spent on this. I don't want to say made up condition, but unnecessary condition is phenomenal. So roadmap just of where we're going to be looking at how the GI tract actually works. Let's look at some physiology so we're all on the same page. Why stomach acid is needed for optimal digestive health, and that's really the key point, is that I was brainwashed into believing that acid was somehow bad for the stomach and I had all kinds of excess of it, and it's just simply not the case. I think we all have a idea of that, and we're trying to grasp that, and so we're going to walk through that tonight. We're going to review current medical literature of consequences of long-term use of acid-reducing medications, and that's a real big thing that I've been doing this talk for 10 years, and a lot of this research wasn't done yet, and we're going to look at some of that tonight. So it's nice to see that researchers are looking at this as a huge problem, and so we really want to delve into that and say, okay, do I really want to take this proton pump inhibitor for 2 years? Is it really the best thing that I need to be doing? And then why typical acid-reducing medications may make problems worse, and then what you can do to improve and maintain proper digestion. So one thing I always throw in my talks, because I get very passionate about what I talk about, is that I don't want you to go out tomorrow, throw all your Nexium in the garbage, and do everything that's on your little yellow sheet, because I'm going to get in big trouble. So don't do that. Talk to your doctor about it. Come see me, make a one-on-one appointment, and I will walk you through everything that I talk about tonight. I do want you to throw out your Nexium, but let's do it responsibly. So that's what I want to go through. I want you to feel as passionate as I am about getting rid of that proton pump inhibitor, that Nexium, that purple pill, whatever you're on. I really feel it's not beneficial in most cases. So that's what this is about. So just a little bit of background so we're all on the same page, why this is such a huge problem. 100 million Americans are affected by this disorder. It's phenomenal. Nutrition, digestion, absorption, bacterial balance all play significant roles in the health of your GI tract. So we're going to walk through all of that as well. Anti-ulcer medications, 9th largest drug class in the U.S. based on volume in 2012. I couldn't find the exact number. I did for 2010. 147 million prescriptions sold in the U.S. Just staggering to me. I think that number should be 0. The 11th largest drug class in sales in 2012, which was $10 billion, just a phenomenal, staggering number to me. 2 years prior to that, Nexium alone, $7.2 billion in sales. Wow. I don't own any stock in Nexium. I hope neither of you do. Well, you probably do with all the Nexium probably on the medicine cabinet. So how does the GI tract normally work? If we go back to normal physiology, that's what I propose doing with acid reflux, is going back to fixing the way the GI tract normally works. The way that it normally works is that you eat a meal, you produce stomach acid, it grinds up your meal so you can actually extract all the nutrients out of it, drives down into the small intestine and so forth, and you extract all your nutrients. So your stomach is there with all the acid to break your entire food down so that it can go back in, make all the cells and tissues in our body. So it's a huge process to do. It's not easily done, and to start with that, we need something very acidic so we can break down that steak and that hamburger and everything that we eat, break it down to its most simplistic form, and rebuild it and make it ourselves, make it the tissues in our body. So the mouth's got to work with saliva. We got to have a proper salivation to coat the food. We've got to have the esophagus working. We'll get into that. We've got to have the right pH in the stomach. We've got to have bacteria in our small intestine, and so on and so forth. That whole tract, from the moment it goes in to the moment it goes out, all the parts have to be working the right way. So, what is the digestive system? What's the function of the stomach? Obviously, it's a large reservoir. We're holding a lot of food there, breaking it down, starting to pull it apart. It's also a food processor. It's mixing with digestive enzymes and such to break down the carbohydrates, the fats, the proteins. And then when we get into some extraction of nutrients, and we'll get into that in some of the studies. It gets into digestion. It starts breaking down and pulling out vitamins and minerals as well. And the big thing with the stomach is with the pH. When you have a very acidic pH, you start breaking down proteins. That's where a lot of the protein digestion starts to occur. And then the last thing we do with the stomach is we get that transfer into the small intestine, where more of the majority of the absorption begins. So that's really where that part takes place. The big thing that I always focus on with digestion is the LES. Has your GI doctor ever told you what that is or explained that? Mine didn't. Hopefully they are. But you can think of it as a door. You can think of it as a high pressure system. It's literally just a sphincter of muscle that separates the esophagus from the stomach. The stomach is built so it can manage a very low pH, a very acidic environment. It's got great cells to handle that type of acidity. The esophagus, on the other hand, is very delicate. It's very sensitive in tissues. And so we have a very specific door here to keep those two worlds apart. They're very different in pH. And this is where a lot of the problems happen, is that door starts to fail. And we're going to get into that as well too, is what opens that door, what makes it loose, what can we do to tighten it up. If we can fix everyone's LES, again, in my opinion, the world of acid reflux and GERD would go away. It'd be something written in history books. So how the digestive system works, we're going to look at digestion again. The food enters the stomach causing stretching, which is going to start this acid production cascade. There's an enzyme called gastrin, which causes more of the pH to build, essentially. So the pH of the stomach is around 1 to 2, depending on when you've eaten, what you have in your stomach. And just to give that a comparison, Coca-Cola soda has a pH of 2.8, which can literally dissolve nails in 4 days. It's a very acidic environment, but we need it. There's so many benefits of that. It's not a bad thing. A lot of people will come up to me and say, well, I thought my body had to be alkaline. There's this whole acid-base conundrum out there. Your stomach needs to be acidic. Your blood can be alkaline, but your stomach needs to be acidic, and we want it that way. Gastrin stimulates an increase in acid production and acid release, and then it also stimulates histamine, which we'll get into as well, causing more production and more acid release. So there's this cascade building effect with gastrin. This is a little bit of a diagram of that whole process. There's a lot of steps involved, and fortunately or unfortunately, a lot of the pharmaceutical companies have capitalized on all these little processes and mechanisms for different drugs to fit in and block certain things from happening, which is unfortunate. But that's what's going on. So I'm going to delve into what I haven't done in my previous talks on acid reflux, is really delve into all of the newer studies that have come about as far as the long-term consequences. They're just phenomenal, and it's frightening. And I personally felt like this all along, that this wasn't a good idea, and I'm glad that researchers have taken it upon themselves to actually look at this stuff and make us more aware of it. Now I've got more science, more tools to provide everyone with the negative effects of these medications. Come on in. There's a couple seats here. Yeah. Yep. So what we're going to go through is malabsorption. So big things with stomach acid that you need is you need calcium. You need stomach acid to absorb calcium. You need stomach acid to absorb magnesium. You need to absorb iron and B12. That is entirely critical. If you do not have stomach acid, you're going to get very little of those nutrients in your body. And I've now got studies to prove that, which is nice. Again, in your normal physiology class, we learned about this, and then in the back of my mind I'm going, why am I giving somebody a drug that's going to stop this natural production of all these nutrients into the body? And back then I didn't have the studies to show that, but now we do, which is nice. And the other interesting fact that, again, in the back of my mind, I was like, oh, this isn't good. One of the big things that stomach acid does is it kills all the bugs, right? You know, so we've got all this food and bacteria on the coming down the pipe, and that stomach acid bath is there to kill all the bugs, the bacteria, parasites, and all the other stuff that unfortunately ends up in our food that we don't really know is there, and that acid kills it. If you don't have that acid there, now they're finding infections popping up. Not good. Come on in. That's all right. There's a couple of seats up here if you want to snag them. Yeah. So this is really interesting. I think there's more studies that are going to come about as well in the years to come. So this is just one study looking at PPIs. So just so we're all on the same page again, the proton pump inhibitor. So what does that mean? That's your Nexiums, your Prilosec, Protonix, Lansoprazole. There's a few other ones out there, so those are the big ones. So long-term use of a proton pump inhibitor in osteoporosis. This is a study that was published in the British Medical Journal in 2012, so not too long ago. Looking at the women's health study, they took a number of close to 80,000 postmenopausal women and was really analyzing this data and was looking at the incidence of hip fracture in these women. And essentially what they found was if that nurse was on a proton pump inhibitor for longer than 2 years, they had a 35% increased risk of hip fracture, which is just it's unbelievable to me. I mean, it's believable, but it's sad that that's happening. And I'm sure there's plenty of ways we can help reduce that and get these patients off of a proton pump inhibitor. It's just not necessary. It's something very simple we can fix. We'll get more into calcium as we go on. So that's calcium. So magnesium is also decreased with proton pump inhibitors. The FDA, which how nice of them to do this, in 2011 released a warning regarding low serum magnesium levels and recommends to providers to monitor patients' levels if they're taking a PPI. So has anyone here, has their doctor mentioned to them about their magnesium level ever? Has anyone had their magnesium levels tested before they started acid-reducing medication? I'm just curious. See, when I was put on a PPI in 2003, 2004, we didn't know about this. Well, in record, let's say. And I'm just interested to see if those that are still seeing gastroenterologists, if this is actually being done. Even though the FDA wrote this letter to providers and such, is it really being followed is my question. So it seems like the consensus is nobody's testing for magnesium levels.
Is magnesium a standard part of your blood tests when you just
yeah, like the Chem 7. Yeah.
Okay, so
it's kind of in there. Yeah. So they may be checking that. Yeah. So it may show up. But it'd be nice if they told you what it is and what the range is, and if you're on the low end or if you need to do something about it. So my suspicions were correct. And all PPIs are associated with this decrease in magnesium levels. So there's not, can I take Prilosec OTC and avoid this versus my Nexium? No, you can't. So what are symptoms of low magnesium levels? Seizures, arrhythmias, hypotension, muscle spasm. An interesting fact that I just learned recently was that you need magnesium for this door to work. Talked about the door up top, but the sphincter between your stomach and your small intestine is dependent on magnesium. For that, I don't know. Does anyone know? There. So you need magnesium for that door to open and release. And here's a study which caused the FDA to write this letter to providers in 2011, talking about this is a big deal. Patients who take prescription PPIs usually stay on therapy for an average of about 180 days. Low serum magnesium levels can result in serious adverse events, again, including muscle spasm, irregular heartbeats, and convulsions. So this was a study that, or this is the letter that the FDA wrote. So another thing that stomach acid is that you need to get into your body is B12, and B12 needs stomach acid again. Long-term therapy with, this is just looking at a study with omeprazole, has been associated with decreased B12 levels. I would draw, or again, the study isn't out there, but it'd be fair to say that, again, the majority of the PPIs, they're all lowering pH or increasing the pH of your stomach, that they're all going to have the same issue, in my opinion. General recommendations is to assess B12 levels at least annually for patients that are on PPIs continually. So my question is anyone getting their B12 level checked by their gastroenterologist? We got one? Okay, you got two? Okay, so that's good. So at least some doctors out there are doing this, which is helpful. So how do you know if you have a B12 deficiency? Diarrhea or constipation, fatigue is a big one, loss of appetite, pale skin, problems concentrating, swollen red tongue, and bleeding gums. So again, one of these things that doctor may, if they're not aware of this, you might have some of these symptoms and they may never even associate it with your PPI, which is really unfortunate. Here's a study that was published last year in JAMA looking at this issue, and their conclusion was anyone that's been on a previous or current acid inhibitor had a significantly association with the presence of B12 deficiency. And then they make a general statement or a safe statement of saying you should consider the risks and benefits with using these medications. I would go so far as saying find an alternative. This study looked at iron malabsorption. So this was a study that was done in the American Gastroenterology in 2009. Essentially, they came to the same conclusion as the calcium and iron, or calcium and magnesium. PPIs reduce the absorption of iron and also may retard the clinical response to iron supplementation. So somebody comes in, they're iron deficient, they're on a PPI, and you give them a supplement, it may never even work, is what that's saying. You need stomach acid to absorb iron. That's critical. So it's nice to have this kind of information out there now.
Would that be true also taking a B12 supplement? It wouldn't even be absorbed.
Right.
And
yeah.
calcium and magnesium.
Calcium and magnesium the same way. I did learn that if you do one way around the calcium issue is calcium citrate is less dependent on acidity than like calcium carbonate or some of the cheaper forms of calcium that are out there.
What about sublingual B12?
That'd be the best way to go, or an injection.
And if you take vitamin C with the iron, does that
That enhances it because you're increasing you're making your stomach more acidic with the iron. Yeah. So there's ways around that. Yep. Yep. So some symptoms of low iron, brittle nails. And the thing I like to point out with brittle nails is that's also a sign of not enough stomach acid. So if you don't have enough stomach acid, or this is actually what happened to me, is I went on my proton pump inhibitor, and my nails started to get really bad. They started getting these hills and valleys. They were breaking. They were just really crummy. That's actually not only a sign of low iron, but it's actually a sign of not enough stomach acid. Other symptoms of low iron: swelling or soreness of the tongue, cracks in the sides of the mouth, frequent infections, and then fatigue. So again, you have all these symptoms, going to the doctor, complaining of this and that. They're going to do an iron check for you. They put you on an iron supplement. You can't absorb it anyways if you're on a PPI, or very poorly. So just, it's frustrating that this, they're not looking at this drug closer and saying, okay, let's try to get rid of this. Now we're going to go into more infections and such. So consequences of proton pump inhibitors and Clostridium difficile, which is just a horrendous infection. I've got a horrible story that unfortunately I had a lady that nearly died at my previous pharmacy because of C. diff. It's just a horrendous infection. It's horrible to get rid of. And she eventually was put on probiotics. Actually, it was a nutritional yeast called Florastor, which proved to be very beneficial for her. I never found out if she was on a PPI or not, actually, though. But the FDA issued a safety warning to prescribers of PPIs and the risk of C. diff infections. The FDA recommends to be on the lowest dose of medication for the shortest period of time. A very safe statement, if you ask me. But at least they put that out there. Here was a study done in 2005 in JAMA again. The conclusion of the authors of this study found a threefold increase of community-acquired C. diff if that patient was on a proton pump inhibitor. And again, this isn't really surprising to me. It shouldn't be surprising to any of us here now. You need stomach acid to kill the bugs coming down the pipe. If you don't have it, you're setting yourself up for more infections. This one just happens to be one bug, C. diff. I'm sure there's other ones out there as well. We're gonna get to one. Yep.
What happens if you've got too much acid, or how do you know if you have too much acid in the tank?
Yep.
I don't know if I missed that.
Yeah.
In there.
No. Yep. That's a great question. I kind of I skipped over that. Has anyone been tested by their doctor that proved you had too much stomach acid?
What is there a special?
There is. I just want to know if anyone's had it done.
Oh, my guess was
No,
that
they just
that I
listen to
do.
your symptoms.
But how did he prove that to you?
I didn't ask for it.
Right. It's all the assumption. That's the biggest thing is
Not,
we're all under the assumption that, oh, you have acid reflux, that you have too much stomach acid. And 9 times out of 10, that's false. I would say 1 out of 10
by my
people
symptoms, I guess that's.
by your symptoms. But that's what happens is that when your body does not have enough stomach acid, this door relaxes. It loosens up. If you don't have any food in your stomach, that loosens up. So it's not that you have this horrendous amount of stomach acid that is just splashing up into your esophagus, causing your heartburn. It's actually the opposite.
I also
Yep.
had a hernia too.
That's a whole other story. That's structure, okay. But when stomach, there is a natural mechanism. When there is a lot of acidity in the stomach, this door shuts down. That's the wiring that we have. Is that when the acidity, when the pH, when you eat let's just say you eat a steak, your pH runs around 3 to 4 right before that steak. It drops down to 1 to 2. That door knows it needs to close down because you've got some very acidic things going on down here. There's one test called the Heidelberg test. Dr. Robert Waters up in Wisconsin Dells is the only guy that I know has that machine. It's a capsule that you swallow with a radio transmitter and a pH meter, and it measures the pH wherever that capsule goes, and you just swallowed it. So where's it going to go? Down your esophagus, into your stomach, through your small intestines, and out the other end. That's the proof that I want, to see when, if you have acid reflux, if you have too much acid, that's a test you need to take to prove it. Robert Waters. Yep. Do they do that at Freighter? Okay. Smart. Okay. So they do that at Freighter now. That's good. That's good to know. But that, again, yep.
I had the endoscopy,
Mm-hmm.
because they wanted to check that you don't get cancer,
Mm-hmm.
right?
Barrett's, yep.
I don't remember why I had it. I do know I had heartburn of that, but then they put me on omeprazole. And I've been on it for years. My doctor says, don't worry. And I think since I have osteoporosis, isn't that bad for your bones?
Yep, that goes back to that one right there.
Oh, you did that one already?
Yep. So are you on a calcium supplement?
I take a lot of calcium.
Calcium.
yeah.
Okay. Because you're
I
probably
don't like dairy products.
not absorbing. I mean, we'd have to test you, but you're probably not absorbing it very well.
But he
Unfor-
said it looked good in there.
Yeah,
In
well,
my
in
endoscopy. I
endoscopy,
don't know how far they go down.
Have your symptoms resolved?
The omeprazole helped.
It helped?
Nexium did too until that got so
Expensive.
expensive. Then it didn't work in my brain.
But that's so. those are the things you're going to want to obviously look at. You know, do you do a bone mineral density scan once a year? You know those. You know, ideally, we'd want. You know, again, my goal for everyone here is to get off of that omeprazole and such, because ultimately you're going to be ending up with frail bones. You're going to end up with a magnesium deficiency, a B12, and you're going to have all these other mess of symptoms. You're putting yourself at risk for higher risk of infection, and so on and so forth. So, you know, that's ultimately what. Yep.
You said earlier that calcium citrate is less acid dependent
Yes.
versus calcium what?
Calcium carbonate is the worst, which is chalk or limestone. It's the cheapest stuff out there. Yeah. All right, so that's C. diff. There's been some studies done on the association of pneumonia with acid-suppressing agents. The American College of Gastroenterology guidelines state that short-term PPI use may increase the risk of pneumonia, but the risk does not seem to be elevated in long-term use. Not sure on that one. The risk of pneumonia may be due to permitting pathogens to more easily colonize the upper GI tract. Well, no duh. You know, I mean, that's obvious to me. Again, if you don't have acidity in your stomach, you know, a lot of these bugs that we're taking into our food are getting in and getting around. Here's a study that proves that PPIs do have this issue with increasing your risk of pneumonia, community-acquired pneumonia. So the study's out there. It's proving that these PPIs are detrimental. They are increasing our risk of infections quite dramatically. So now what? Where do we go from here? What do we do? What do I need to avoid this big mess? These are just some typical antacids for heartburn relief that I've pretty much taken all of these on here, quite honestly. Calcium-based antacids, which are the Tums, magnesium hydroxide, magnesium carbonate, which is your good old Mylantas. I've drinking bottles of that by the gallon probably. H2 blockers, your Tagaments, your Pepsids, your Zantex. My favorite was Tagament Complete, which was a combination of Tagament and calcium carbonate. That used to work for a little while. And then proton pump inhibitors, the Prilosec, the Nexiums, the Previcids, Acifex, omeprazole. You can add Zegrid to this list. I heard somebody else say Dexilant. Yeah. I mean, there are just more and more of these coming out. It's a big market. I mean, Nexium has 2010 had $7.2 billion in sales. I'd love a piece of that, right? Who wouldn't? Just unbelievable. I like to show this. This is a little snippet of the package insert for Nexium. And so in their package insert to the pharmacist, to the doctor, what I like pointing out is the frequency of how long that the manufacturer says you should take their drug. And that is for 4 to 8 weeks. Has anyone been on a PPI for more than 8 weeks? Nope. So then your doctor's prescribing your drug off-label. That's not good. I mean, and how can you get to $7.2 billion in sales in 1 year if only everyone's just taking it for 4 to 8 weeks? I mean, when I used to work in traditional pharmacy, I can't tell you the number of PPIs I dispense. I mean, every day, just out the door, like really? We have all this acid reflux problem? Unbelievable. There are some, if you go further down in the package insert, there is another frequency indication table that there's a couple of conditions that push out the length of time to, I think it's 16 or 18 weeks. But, restore physiology is what we need to do.
I got a quick question.
Yep.
I'm wondering now, because I'm assuming that your muscle is not working properly on a PPI.
Yep.
Is it possible that you damage it irreparably after 30 years on a medication?
It's possible. It's a good question. I don't really know the answer to that, except to try to see if it'll go back to its normal constriction. Yeah. So this is the part that I love talking about, is restoring, normal GI health. my favorite thing, which is going to sound crazy, but I want everyone to take more stomach acid, literally. Hydrochloric acid with pepsin. Pepsin is going to increase gastrin in the body that we talked about earlier. Gastrin is like this, it just fuels more acid production in the stomach. It's needed for protein digestion, and obviously we just talked about vitamin and mineral absorption, so your calcium, magnesium, iron, B12. I want to get digestive enzymes back into your system, the machines that help chew up your food. Probiotics, since we are killing off all the good bacteria and we're letting in all the bad, I want to get you back on all the good bugs that you need in your GI tract. So they inhibit the growth of harmful bacteria and continue the digestive process as well. And then some zinc and some glutagenics. And that's the key. Yep.
What about the yogurts?
I don't think they're not, you could take one Florigen capsule is equal to 10 cups of yogurt. Yeah. You can still have the yogurt, but I'd still recommend the protein.
That could help
It could help it a little bit, in my opinion. I don't think enough. It wouldn't hurt it. Yeah. So let's delve into all of these topics here. God, acid. That's good acid. I love apple cider vinegar. It should be raw, unfiltered, and organic if possible. I like Bragg's is the one that I prefer. A quick way to resolve acid reflux symptoms in a pinch is taking a teaspoon of apple cider vinegar, 8 ounces of water, and drinking that nice and slow. And that can sometimes trick that LES to close up nice and tight. I've done that millions of times by now over the last 10 years for myself. And it doesn't work all the time, but it's a great little trick. It costs you pennies to try it, or for that quick trick, and just a neat little thing that I've learned along the way. The other thing you can do and substitute if you don't have apple cider vinegar is pickle juice. Just drink pickle juice. It's a great old-time remedy that one of my patients taught me that they used to do.
Could I ask you a question?
Mm-hmm.
The vinegar, does that interfere with your other medication?
No.
It doesn't.
You can drink it with each meal. It's just even if you don't have acid reflux or GERD or heartburn, whatever you want to call it, drinking apple cider vinegar with each meal is just going to help with that digestive process in general. There's good probiotics in apple cider vinegar along with potassium, so just good for overall general health.
I have a question in regard to apple cider vinegar too. Please, stepping back a second here into when you said sometimes it doesn't work. Why wouldn't it work? Like,
You're trying to trick that LES to close, and it just doesn't sometimes. Or what happens is it does close, but you still have enough acid that's squirted up into your esophagus, and it's just sitting there and just killing you. So what I've learned to do is, first I'll do the apple cider vinegar trick. If that doesn't work, I will take a little bit of baking soda and mix that and drink that, and sometimes that'll neutralize the acid in the esophagus, and then I'll go back down with a little bit of apple cider vinegar again. So I'm trying to trick that door to close.
But you don't do the baking soda with every meal?
No, I don't. The baking soda is only if my apple cider vinegar trick didn't work. You're feeling in the burn, it's killing you, you just did the apple cider vinegar, it's still killing you. I want to try to neutralize that acid and then follow it back up with it. So it's a little bit of, you're going to have to figure out how it works best for you. That's what I've done, and I'm just kind of trying to share that.
The baking soda, is it like, how do you do it? What's the cup?
Teaspoon and not even 8 ounces, 3-4 ounces of water. Just mix it up a little bit, and just sip that down. And I've been doing that for a very, very long time.
You have to kind of space that out, don't you? Because if you mix vinegar and baking soda together, you
Well,
like,
right. Going back to the grade school when we made the volcano. Actually, in 3rd grade we did that exact same thing. But I space it out in minutes, and it's just fine. I haven't exploded yet. So, but that's a good. Yeah. You want to do it right on top of each other. Let that apple cider vinegar get in a little bit. So again, a nice trick that I liked. I lost a slide. The other slide that I was going to talk about was betaine hydrochloride and pepsin, which is This is your stomach acid pill that's in the protocol, and I'll go through that at the end. So I'm just going to skip this for right now. We'll talk about that later. Digestive enzymes. So what to look for? You want a digestive enzyme that has a broad spectrum of enzymes in it. Something that's going to break down your fats, so like something like lipases, amylases, something that's going to break down carbohydrates, a broad spectrum digestive enzyme. So the one that we carry is, we got a couple of them, but Digeszyme, it's got amylases, lipase, pectinase, and the list goes on and on. Alpha galactose. I mean, there's just a whole slew of them in there. You want a broad spectrum of enzymes to break down the different components of your food. That's going to keep that meal from just expanding and just sitting in your stomach. And you're going to be able to extract more of the nutrients from that food. So which type is right for you? There are different enzymes out there. There are enzymes that are for vegetarians, or vegetarian sourced, I should say. And then there's enzymes more like bile and such from animal products. So we have those different options out there. Which one is right for you? I've played around a lot with enzymes, and it's just a matter, again, of what your dietary habits are, what you're eating. Are you eating mostly protein versus carbohydrates? Are you eating a lot of fat? I can help you kind of pick that out and steer you in the right direction. If you really don't know where to start, I always pick the vegetarian digestive enzyme, and that seems to be generally suited for most patients. So that's the one that I typically go to first. And then the other thing that you want to keep in mind is, ideally, most of your enzymes are coming from the food that you eat. So there's always this debate of, when I eat vegetables, you're going to have natural enzymes in those vegetables and fruits to break themselves down. But you don't, how much of those do you cook? I mean, you can't eat, raw broccoli for breakfast, lunch, and dinner. You can, but it's just going to get really tiresome, I'd imagine. But you want to keep in mind that you want to keep your food as raw as you can, because that is going to preserve the enzymes that are built in with that food to break itself down. I'm not going to get terribly into that, but that's the thing you want to kind of keep in mind. Don't steam your vegetables every single night for dinner. Eat some of them raw. A number I've heard thrown out is 1/2 to 1/3 of your veggies should be eaten raw. They have natural enzymes to break themselves down. Probiotics, take them. Especially if you've been on the PPIs, your whole GI tract, the bacteria, the good bacteria in your GI tract is just probably not where it should be. So you want to get that repopulated. Every other day, it says, equals to everyday dosing. What I mean by that is, there was a study that showed if you take probiotics every other day, you have just as much benefit as taking them every day. So you can stretch your dollar twice as far. It's a nice little trick. I mean, there was a slight difference in benefit, but it was insignificant. So, and I know probiotics are expensive. You can let that dollar stretch twice as far. The one thing with the big probiotic that's on your handout is the orthobiotic. My word of caution with that is don't refrigerate it. It's actually, a lot of probiotics you have to refrigerate to keep the bugs happy. With orthobiotic, you do not want to refrigerate it. It's actually going to kill off the bugs quicker. So just heed that warning. And cycling probiotics, these are not probiotics that ride bicycles. They are, you want to take your probiotics in different increments. You don't want to take them every single day or even every other day. Maybe take them every other day for 1 to 2 months, stop for a month or two, and then go back on them. You don't need probiotics every single day or every other day for the rest of your life. What you're trying to do with a probiotic is to increase your natural flora. It's always going to be there in some capacity, and the probiotics are just there. They're just transient. They're just kind of hanging out in the small intestine and elsewhere. They're pushing out the bad bugs so that your natural flora can prosper again. And so it's something you don't have to take all the time. I don't take probiotics every single day, or even every other day for that matter. I kind of go in spurts with my probiotic. There's a big debate about prebiotics, FOS, fructooligosaccharides, this food that the probiotic needs. I'm not set on them. I've taken them. I haven't seen much benefit to them. I've seen studies both way. Yes, you should take them. No, you shouldn't. If you want to try them, fine. See if they work for you. But I didn't find much benefit to the prebiotics, honestly. And then zinc. Zinc, I think of zinc as a chemical glue, or I should say biochemical glue. It's often overlooked. It's very simple to take. It's a daily dosing. It's inexpensive, and it just helps to bind soft tissue together in the esophagus. So, or in any tissues for that matter. It's just a good glue, or a good mineral to take. It just helps to put things back together where they need to be.
What dose of that would you take?
Anywhere from about 15 to 50 milligrams a day. The average is probably about 30 milligrams a day is what I typically recommend. The reacted zinc, which I think is on the protocol, says 54 is the one that we have. So
What does the reactive zinc mean?
it means that it's more absorbable. So reacted it's a chelated mineral, which means it's attached to an amino acid, which the body sees that mineral more as a food source, versus, let's say, zinc oxide, which is just a salt form, and it doesn't have the ability to absorb into the system as well.
Why is it, why is the doctor don't want you to take zinc?
Wha-
Or
I don't-
would you take it and she,
I can't think of a reason why they'd want you to not take zinc, unless it would interfere with a medication, possibly. But I can't think of what that would be. They did not want you to take zinc?
no. Even for just a short term.
I do not know on that one. I'm not sure.
If you have zinc in your multivitamin, are you probably
Is that enough? Probably not. I think a typical multivitamin is not going to have near 30 milligrams. That's kind of I mean, if you can get away with 15, but again, for a bottle of zinc, which might cost, $10, $15, again, I say it's worth trying for a month to see how your symptoms respond to that.
And what does the zinc do as part of this process?
It's just helping the cells to heal themselves, essentially. I always think of it as just binding the cells together so that esophagus can actually repair itself. So.
A liquid form of zinc, is that a good?
There's a liquid form of zinc. I believe it's zinc carnosine, which you can actually, if you have a smell to the zinc, I want to make sure I get this right. If you're zinc deficient and you take the liquid zinc, you don't smell it. It doesn't taste like, or it doesn't smell like anything. But once you have enough zinc in your body, it smells like dirty socks. That's the way it goes. Yeah. So there's a I can't remember the company, but they sell liquid zinc, and it's actually taken to you take it until it smells, essentially. And then you could do that as a test for yourself to see if you're zinc deficient. The other thing that I have on here to see if you're zinc deficient is look at your fingernails and see if you have these white little spots. I've got one there, and I got a little one forming here. That's a classic sign that you're zinc deficient. So very simple test. We can all do it right now. If you got them, you got to take some zinc. If I really take my zinc all the time, you can tell I haven't been taking my zinc every day. But if I do, after about a month or two, I don't have any of those little white spots on my fingernails. And then also on the handout I have on here glutagenics. I say a must for every home, every office, in your car, all of your cars, wherever you can go, have some glutagenics around. And I do have a bottle of it. It's a powder. So it doesn't travel well, but with my bottle I did split it up into littler bottles and I put it here, and I've got one at home, and I don't have one in my car, but
Does it have a bad taste?
well, my wife thinks it has a bad taste. It doesn't. It's not horrible. And actually, I've got an open bottle. If you really want to try some after the talk, I'd be more than happy to share mine with you. I actually have 2 or 3 of them, canisters open here. Because it's expensive, and I don't want you to spend $70 and then you're going to absolutely hate it. I don't want you to do that. So if you want to try some tonight, let's do it.
So you take a teaspoon?
I don't measure a lot. I do a teaspoon.
Okay.
to start, like in about 4 ounces of water. I don't take a lot of water, because when you're doing this, you don't. When I first started doing this, you're drinking so much water with everything, and you're getting just full of water, and that's getting that food closer up towards the door on the top, which is not good. So I try to do everything as in least amount of water as I can.
Is that the same as L-glutamine? L-glutamine?
Yes,
Same thing.
same thing. Yep. Aloe vera and licorice root. That's in the glutagenics. Yep. Yep. I don't know. Never really asked that. It seems basic, yeah. Yeah. I don't know what it be. I know licorice root in general is a little bit more pricier. The aloe vera is, I know, cheap. So it's probably more between the licorice root and the glutamine. It's DGL. Yep, that's my next line. Yep, yep. Same thing.
You can take those, I have all three of those separately.
Yep, you can. Yep, yep. Your dosing on the glutamine is about 1,500 milligrams a day, so you have to take quite a bit of it. So see what you've. Yep, which is a big dose. It's 1,500, so 1,500 milligrams is what you typically want. That's a dose. Per dose.
Oh, per dose.
Per dose. Yep. So you're doing about a teaspoon of this powder, and you can do this 2-3 times a day. I've tried this in between my apple cider vinegar, baking soda, and glutamine trick. It sometimes works, but the best way for this to work is, I think, just taking it 2 to 3 times a day, a good, let's say, half hour before each meal, so you can sit down and coat the esophagus, coat the stomach, and that's really where it's doing. This isn't a quick emergency thing. This is more of a maintenance thing. I've tried to use it in an emergency situation where I have a horrendous heartburn attack. Doesn't work as well. But it's more for the long haul.
Do they recommend this for Barrett's syndrome?
They don't. I don't see why you couldn't try it for Barrett's. I don't know how efficacious it's going to be, though. Quite honestly, you could try it and see, but that's a tricky one. Yep.
How much aloe vera and licorice root or PGL would you need if you're going to take the in 3 individual?
In threes. Let's look. Let's see. A teaspoon is going to have 500 milligrams of the licorice root, and then it's going to have 50 milligrams of aloe vera, and that's the extract. So I used to sell and recommend the aloe vera juice and gel, if you've seen like at Outpost or what have you, and that's fine. You can, and the normal dosing on that liquid aloe vera juice or gel is it's like 1 to 4 ounces a day. You could do that too, but again, for me it was a lot. I'm swallowing so much liquid. When you're really going through this, you're trying to minimize that.
And this glutagenics is for repair and maintenance.
Repair and maintenance. Yep.
That has everything in it?
Yep. Yep. Mm-hmm.
Is the glutagenics, is that for anything else besides acid reflux? Does it have any other benefits?
Not that I know of. I mean, I really just utilize it just for the healing of the soft tissues of the GI tract. The one note people, oh, go ahead.
Why would that be not as effective with Barrett's?
Well, the cells are changing in Barrett's. They're not in the esophagus down there. They're going through a change, and so they're losing their natural soft tissue configuration essentially, and so I just don't know if it's going to penetrate and change those cells back to normal esophageal cells or not. I just don't know. I mean, is it going to hurt them? Probably not. But I don't have enough experience to tell you, yeah, it's going to fix it. But I just don't know if it's there. Yeah. The one thing that does come up with licorice root is licorice root can increase blood pressure. The licorice root that is in here is deglycinated, which means it has less of a propensity to cause high blood pressure, but I would still monitor your blood pressure. When they deglycinate the licorice root, it's not 100% deglycinated. There's still going to be a little fraction there that gets through that does not get converted. So if you have high blood pressure and you're taking a ton of this, which is fine. Just monitor your blood pressure, see where you're at, so you're not getting too high of a blood pressure issue. If you are, we could switch you over to the separate 2-way. We'll get rid of the licorice root altogether and just give you aloe vera and glutamine. So we can work around that. And then DGL. So this we kind of touched on this, but DGL, or again deglycerinated licorice. I just say DGL because that word's way too long for me. Again, I have this on hand at all times too. I do like this for a quick fix. I've got some tablets here that I still take on occasion. They don't taste very well. The best flavor to mask this is chocolate. So the ones that we have like German chocolate flavor. Again, I must be an odd duck because it doesn't really bother me, but
You have to chew them?
you gotta chew them, or some people can. I just sometimes suck on them, just dissolve them in my mouth and let the licorice root kind of go down the esophagus and coat it. Again, minimal issue with hypertension, but again, keep an eye on it. There was a study done in the British Medical Journal that showed that DGL was as effective as compared to OTCs. I'm probably assuming they were vague on that, probably maybe Tums for peptic ulcer disease. If you're going to take DGL continuously, like you're popping these things like candy and you're having a lot of problems, and that's fine, just make sure your doctor's measuring or keeping a snapshot of your kidney and liver function. Not that it's a huge issue, but if you do take a lot of licorice root and such, you can possibly run into some kidney liver issues. I've never seen it, but just again, I want you to be aware of everything that's out there. Dosing 1 to 2 tablets 30 minutes before meals, 1 to 2 times per day, or you can just take it as you need it. That's sometimes how I do my DGLs. For me, I can feel the kind of tingle start, and I know something's creeping up and brewing. I'll take a few of those, chew them, and see what happens as well. Again, if that doesn't work, I go back to my volcano experiment. I'll do the apple cider vinegar, and they do the baking soda as well. But for the most time, this does a good job of settling things down.
I have a question. I don't know, I came a little late, so you may have covered this, but once you get your stomach healed, you know, like, I mean, it sounds like this is something you have to do all the time from what you're saying, but can you, I mean, by your diet changing and maybe eating more fermented foods and things like that?
Yep. Yeah. So all of this is more of you're kind of in the trenches. You're like when you're really struggling with it. That's what this is really going through. But yeah, and actually that's my next slide is diet and lifestyle. So once you get your stomach repaired and back to where it needs to be, you don't have to take all this stuff anymore. That's the beauty of this whole program is that, yeah, I take these occasionally, but it's not like I'm taking them all the time. It doesn't consume my life like it did. And that's ultimately what the diet and lifestyle is going to be a big part of is you're not going to have to worry about, taking all this stuff. You have it around if you need it. If you cheat on your diet too much, which I tend to do, shame on me, but then you have some of this stuff in the background that you know what to turn to. Yeah, and that's it's perfectly. And so eat smaller meals, wear loose-fitting clothes. Are doctors still handing out like guides that have some of this information in there? They did when I went to the GI doc. So it's at least I do believe all these recommendations are still beneficial. Limit food intake to 3 to 4 hours prior to bedtime. Elevating the head of your bed 4 to 8 inches. The pillow thing is what I do, but the problem with that is you're crunching your body so that potentially you're pinching down in your esophagus, which isn't good. So I would actually recommend getting like just one of those pillow wedges. Lose weight if need be. That's just kind of pinching down on the esophagus, pushing more of that food up to the esophagus. Stop smoking, drinking coffee. The coffee one is a big thing for me. I'm still a coffee drinker. I know when I drink too much coffee, I run into trouble. Whatever that food or drink is for you, I had to give up coffee for a very long time, but in the end, it was definitely worth it for me. But whatever those triggers are for you, find them, identify them, stay away from them, do the protocol, get your GI tract working the way it needs to be. This is just one list, but this is taken out of a book written by Dr. Jonathan Wright, entitled Why Stomach Acid is Good for You. There's just a ton of stuff. This is just a short, we could probably add to this list all night long. But foods that weaken the LES, fats, chocolate, coffee, mints, especially peppermint and spearmint, sugar, alcohol, onions, any kind of food allergies. For medications, cigarettes, bronchodilators like albuterol, NSAIDs, calcium channel blockers, diazepam, nitrates, Demerol. And then you've got on the other side things that actually irritate the lining, citrus fruits and juices, tomato-based foods, spicy foods, coffee, carbonated drinks. The list can go on. For me, it was bananas. Bananas drove my acid reflux crazy. I don't know why. I stay away from bananas. Aspirin, NSAIDs, tetracycline, potassium chloride tablets, iron salts. Those are all irritants. So again, if you're having issues with medications, you're on a whole list of these and such, let me know. We can work through some of these things and find some alternatives if we can. This again was taken from Jonathan Wright's book, whole slew, and there's a lot of research out there on associations of low stomach and acne, Addison's, allergic reactions, celiac, childhood asthma. I see a big correlation with childhood asthma and low stomach acid. You give a kid some stomach acid pills like the betaine hydrochloride and Pepsin, and lo and behold, their asthma improves dramatically. Autoimmune hepatitis, diabetes type 1, eczema, gallbladder disease, Graves, lupus. A lot of autoimmune issues going on here where the body's attacking itself. MS, osteoporosis. I wonder why osteoporosis is on there. I wonder why. Pernicious anemia. I wonder why that one's on there. Right now it's rheumatoid arthritis and so on and so forth. So a lot of times, there was one lady, I didn't think about this till just now. Lady came in with acne, rosacea at my old pharmacy, just classic acne, rosacea, and filled her, what do they prescribe for rosacea? The topical antibiotic creams that don't work worth a darn. Told her to take some betaine hydrochloride, and lo and behold, her rosacea went away. I was proud of that one. So these things work. They're out there. So take-home points. So low stomach acid or high pH is a loose LES, which is going to cause your acid reflux. That's the big thing. Don't think that it's because you have too much stomach acid. If somebody says you have heartburn because you have too much acid, I want you to prove it to me. There is that 1 out of 10 person that may have that. But generally speaking, the majority of patients, myself included, it's not enough. Yep.
So if you have low stomach acid, is that just a natural condition? Your body just didn't get enough, or is it coming from some of these other
Well, it could be coming from some of those other things. As we age, the stomach lining thins, and we can't concentrate the acidity as much. So there's a lot of different factors involved. For me, it was my poor diet, and I contribute, and I think low stomach acid to some degree. And so I cleaned up the diet, did the repair, that's the way to go. So again, clean up your diet. Stomach acid is good for you, so don't, when people, I got so much stomach acid, I gotta block it, I gotta suppress it. Don't buy into that, please. And then find your triggers and stay away from them. Again, for me, it was bananas. I was at a point where I was even drinking water. Is anyone drinking water and got acid reflux symptoms? That was, they had me on Prevacid twice a day, or nitidine, drinking the Mylanta, and I drink water, and all of a sudden I just get a huge flare. It's like, how could water cause, all those symptoms? So that's the deal. So the protocol is everyone have one of their Halloween sheets. So I don't know what color to put this on, but really, again, what this is intended for is, work with your physician, work with me on going through this. It's going to take time, it's going to take some effort, but I think in the long run, you're going to see all the health benefits of getting off of that proton pump inhibitor. So there is a repair process. So all those things I went through, there's a couple things on here I didn't touch on. There's like cod liver oil that I have in here. But essentially that first 2 to 4 weeks, you're trying to repair your soft tissues of your esophagus and GI tract. You can't jump into the acids per se, like the apple cider vinegar, right off the bat, so don't go home and drink your pickle juice or go drink your apple cider vinegar unless you've done this repair process. And I know that because I've done it. When I learned about the apple cider vinegar trick, I tried it right away, and oh my gosh, it burned like crazy. So you got to be careful with this stuff. So do the repair process, 2 to 4 weeks, and that's a minimum. Some patients I've worked with, they're on this for 3 to 6 months. It just takes everyone's different. You might take longer to get this thing healed up, but it eventually will work.
You don't want to do that until you're off the next year.
Yeah, so there's a whole protocol for tapering your acid reflux medication. So especially with the PPIs, your body's smart about this. So when you're on a proton pump inhibitor, your body's going to produce more acid pumps to try to overcome the proton pump inhibitor. So has anyone tried to stop their proton pump inhibitor and then, oh my gosh, they're in horrible pain and like, why did I ever do that? Why did I skip that dose? Because your body's trying to overcome that. It knows it needs stomach acid to break down the food and such, and so it's going to try to keep just building up above that proton pump inhibitor to keep, and then so you got this whole rebound reflux issue where you got all these pumps pushing out acid, and now you're in real trouble. So you got to very slowly taper your medication. So there's a whole procedure for that. So that's the first 2 to 4 weeks minimum, and then you've got your acid reintroduction. This is then I go through the apple cider vinegar trick. If that works and you're successful with taking in that little amount of acidity, then you can move down to your last step, which is stomach acid substitution, which is basically just, yep. Oh, yes.
The apple cider vinegar is now available in capsule form. Is good?
I don't like it. I can't tell you why, except it's not in the raw, natural state. It doesn't have the probiotics in it. I know that. I think the apple cider vinegar capsule, I believe, if I'm not mistaken, was the idea behind that was for more of a weight loss effect. But I would recommend, I wouldn't get the capsules.
Now, the Braggs and a couple others say with the mother. First of all, what does that mean? And if you get it without the mother, is that?
I've never seen it without, to be honest with you. Oh, you've seen it? Okay. I don't know what that is. I think it's that white filmy probiotic mess on the bottom.
Okay.
Is it? Okay.
Now, we've seen that with taking out the natural honey too. What does that do?
Taking the apple cider vinegar, it just makes it taste a heck of a lot better. And you could do that. Yeah. I used to mix a teaspoon of honey with the teaspoon of vinegar and then 8 ounces of water. Yeah. I actually think they make a drink with that now. I don't know if, yeah, they do. Okay. Yeah. It's expensive. I just buy your honey, buy your Braggs, and make your own. Instead of paying probably I think it's like 3 or 4. Isn't like it's expensive? I know it was expensive. I thought. And the last part on the protocol I've got in here. Get down to the bottom. Day 1, day 2, day 3, day 4. I did switch that. I said I used to have the word meal in there. So some people want to go really fast on this. They want to get this taken care of. And I had the word meal in there instead of day. So I'm glad I switched this because I would go slower. There are some protocols out there, if you search this far enough, that you take 1 betaine hydrochloride with breakfast. If that's fine, you take 2 with lunch and 3 with dinner and so on and so forth. I think it's a little too fast. So I'm glad I switched that. So you've got day in there. That's good.
What does pepsin do?
That accelerates that gastrin release, and that gastrin then is that cycle of making more acid in the stomach. Just gets that cycle going. Yep. So if you want to delve more into this, I know we had an hour or 2 slotted tonight, but Dr. Jonathan Wright is what really got me going on this, why stomach acid is good for you. That was written, I don't even know if I have a copy anymore floating around, years ago. And then Walter B. Guy has got a book called Hydrochloric Acid Therapy, which again seems crazy that we're talking about taking more stomach acid when I was under the perception that that I had too much. So that is me when I was 9 years old. So I like talking about weird stuff like acid reflux. but I also love fishing. So that's my dad and I when I was 9 with a Northern, and that was me two falls ago, out on Pewaukee Lake with a muskie. It's my largest one ever.
Nice
So, yeah, so we can talk about that too. There's my contact information if you need it. Obviously, I'm here pretty much every day of the week, so you can always find me. Consultations are by appointments because I am crazy busy throughout the day. You can always pop in though, and I'm more than happy to sit down with you at any time. I'm sure you're all aware of that, but that's my policy here. But if you want my undivided attention and a good 30-40 minutes of my time, usually I schedule it before I open. I open at 9:30, so I can get you in at 8:30, that kind of stuff. If you want to meet late in the evening like this, let's do it.